Today we discuss clinical audit, and this is part of our clinical governance discussion. So we said as a hospital or as a specialist manning a new unit, there are clinical governance processes that you need to put in place. The key ones we spoke about that are directly relating to the clinician, clinical effectiveness and research, audit, risk management, and education and training. You have to establish these in your center, and these are what we call the care components of the clinical governance. And most of the other parts are things you do with managers, IT staff, and leaders in the institution. But clinical effectiveness, we said you should have guidelines within your setting. It's a safety risk if you start processes without guidelines, because then there is no direction. And you should institute audits regularly. You should have a means of identifying problems, managing problems, and investigating problems. And you should have a continuous education stream. So what is audit? In audit, we review our current health practice against an agreed standard. So if the standard for cesarean sections is, let's say, 15% of all deliveries, we audit our practice and compare it to the standard and ask ourselves, why are we higher than the standard? Is there an acceptable reason why we are higher than the standard? Are there things we are doing that can get us back in line with the standard? If instrumental delivery rate should be about 10 to 15%, and we are doing 1% instrumental delivery rates, we ask ourselves, why are we out of target? So that is what audit is: current practice against an agreed standard. And it's designed to ensure that as clinicians, we provide the best level of care and we constantly improve our practice where it is not meeting the standards. So there's an audit cycle, and the audit cycle involves identifying issues within your practice, identifying a standard, collecting data on current practice, analyzing the data, implementing change, and re-auditing your practice. So how do we identify issues? You look at national guidelines and you ask yourself in your practice, are you complying with national guidelines? Or maybe you've noticed problems. For example, if you notice that your second stage is your infection rate is too high and your instrumental delivery rate is very low, you've been talking about it. Why don't you institute an audit and look into it and see what is happening? Why are you having high second stage cesarean sections and what you can do about it? You also look at areas of clinical practice where problems have arisen. Maybe you're having too many elective gynecology cases getting cancelled. So you audit it and try and find out why this is happening. And if you have standard criteria within your practice that you audit yearly or monthly or half yearly to see if your service is improving or remaining the same. There are also other places where you can get auditable topics. So most guidelines, especially the Royal College guidelines, will have auditable topics or auditable standards. They're things that you should audit in your practice to make sure your practice is keeping up to standard. So for example, on the recurrent miscarriage guideline, you look at an auditable topic of percentage of women and people completing the recommended investigations. So the guideline has a set of investigations, and everybody coming to your recurrent miscarriage service should complete all those investigations. So your standard is 100%. Are all your patients completing all those investigations? Why are they not completing the investigations? Is there a knowledge gap? Do you have to create a guideline? Do you have to update your guideline? These are all things that you need audits for to help you with. So the standards could be national standards, global standards, or sometimes there are no standards, so you have to locally define a standard. And then once you have a standard, you start collecting data from your current practice. So you review patient records, make a pro forma, and just enter everything in Excel. And once you're done, you analyze the data. So for example, based on ECV guidelines, your average ECV success rate should be about 50%. If you do an audit and analyze your data that shows that your practice success rate is 20%, then you need to look at your protocol and see why you're at 20% and what you can do to meet acceptable standards. If you're at 80% success, then you need to really look at what you're doing differently and whether you can teach other centers how to improve their success rate. So these are all reasons why audit is very important. So once you've identified the problem, you need to implement change. So you institute a quality improvement project to try and implement change. So you plan a project, you do, you study, and you act. So for example, you've defined that all your elective cesarean sections should happen between normal working hours, between 9 and 4 p.m. You audit and realize that 60% of all your electives are during on social hours after 5 p.m. over midnight into dawn, and patients are giving you negative feedback. As a system, this is something that you need to look at, and you have to implement a change cycle. So you start a quality improvement project and you try and institute things. Maybe you limit the number of cases booked because you're booking too many. Open a new theater just for electives. Maybe if you're working as teams, as some centers do, you make it an open system where there's a booking system, and therefore if team A has 2 and team B has 6, then we make it an open booking where on Monday some of team B's cases can go into team A, so it's 4 per day, so that you don't end up canceling team B's case and having free theater sessions in team A's day. So these are all things that you do in a quality improvement project to try and address problems that arise from your audit, and give us some time for your improvement projects to work, and then you re-audit again. So you close the loop in your cycle and re-audit to see if you're making systemic improvements in the organization. So audit is important because it assures patients that the right standard of care is being maintained. It's important for appraisal, for healthcare personnel. Ideally, in organizations, everybody needs to be doing audits. Everybody needs to be getting involved. It's not just doctors, midwives, nurses, managers. Everybody should be auditing their practice so that we can all achieve continuous improvement within the organization. And it demonstrates to managers and leaders they are improving the organization, and then helps us to keep an eye on key targets to make sure standards are not falling. Thank you.